since many years, a lot of doctors are looking into the property of the stem cells which are present in the fat. We know that fat is the highest source of stem cells, more than the bone marrow, and it's much easier to harvest these stem cells. Instead of going into the bone to get the bone marrow, with a simple, small liposuction, we can harvest the fat and having the stem cells. Many years have passed since they have studied the stem cells, and they found out the potential that they have in terms of regenerative medicine, in creating a new vascularization in the tissue they're injected to. But there was no possibility to just extract them and inject only them. It was always mixed with the fat. That is the thing that the bioscience laboratory decided to start looking into that. So what they are doing here, they take the fat from the patient through the normal liposuction. They destroy the fat, they keep only the stem cells, and they put them in culture and they expand them. So usually we give them around 20-30 cc of fat. They take this amount of stem cells and multiply by 10, 100, 1000, depends on what we need. This is a process that will take about 2 to 3 weeks. At the end of that, we can use directly the stem cells to inject in the patient, or we can cryopreserve them. So put them in the freezer and use later on when the patient will need. What can we do with the stem cells? So once we harvest, we expand them, what is the purpose to have the stem cells? Number one thing is we can use it for rejuvenation. So we can use it for the face to make the skin more glowing, much better, more compact, and this is number one. Number two is for hair loss. So we can use the stem cells to push the hair follicle to regrow new hair and reduce the hair loss. We can use it for scars. When there is a scar is a pathologic tissue that can be treated with the injection of stem cells that will reduce the appearance of the scars and improve the quality of it. We can use it during body reshaping, because we know that when we do a fat transfer, so taking the fat from one side and injecting the other, the main, we can say, complication is the not survival of this fat, because it will not survive the transplantation. With additional stem cells to this fat, we can achieve roughly a 99% of survival of the fat that we transfer to another area. It can be the face, can be the body, can be the buttocks, the breast, whatever. So the use of stem cells is wide and can be used in many different areas. Now, for example, there is a huge research on orthopedics to inject the stem cells also into a joint in the knees to postpone the moment where they need an implant or knee replacement. So the use of stem cells really is still developing, but the potentials are huge, and the results we see with the quality of the skin after the treatment is absolutely amazing.
So many questions in my mind. One of them is, obviously since this research is new, Doc, do you think it'll somehow at some point outpace, the artificial stuff like fillers and hyaluronic acid and all those things? Because then people will be like, okay, why should I inject external stuff into my body when I have my own fat which is in my body? I said, but what if someone is skinny and if they don't have fat, where do they take the fat from?
So for the first question, absolutely, there will be a moment where patients will love to, and still the moment is happening now. So patients are asking for the things. Example, they want the breast augmentation to be done with that, the buttocks augmentation. The best result on the buttocks, I'm not a fan of buttocks implants, for example, because buttocks implants, to me, is not a nice outcome. There are many complications that can come in. Why? If we put the fat into that with additional stem cells, we can achieve a nicer result. The surgeon can model the buttocks of a patient as they want, and the result is stable in the time. So for sure, this moment when the external fillers will be abandoned will happen. We have to consider that, of course, stem cells as a higher cost is not an immediate result. So some patients still want something cheaper, quicker, and lunchtime treatment and go back to their life. So these are the variation between the two treatments. And of course, if the patient doesn't have fat, it can be an issue. It can be an issue when we need to use the fat as a scaffold to transfer the stem cells. But when we use only the stem cells, 20 cc of fat we can find in any patient, honestly. So it's not a major deal. So for the stem cells treatment, every patient can give us 20 cc of fat and we can extract the stem cells. Perhaps if you are a little bit chubby, your stem cells are more active. If you are more thin, they can be a little bit more sleepy, take more time to grow. But it doesn't matter, the outcome is the same. Bioscience Institute, where we are now, has started this activity with the umbilical cord stem cells. And again, what is the benefit of having the umbilical cord stem cells still is partially unknown, because we don't know how to use them. The stem cells from the fat are more known for what they are doing, so we know what they are doing. So the education of the people saying these cells can solve a lot of problems for you, and the best thing is to save them as early as you can. So when you save them, then you have them for the rest of your life and you can use whenever you want. So there will come a time where all the people will know about that, and they will have the queue outside the clinic that I want to harvest the fat only and keep them.
Can you tell us where future patients can come and avail some treatments with regards to stem cell research?
So the core of the lab is based in Bioscience Clinic, which is in Dubai City, and is the most advanced lab in the Middle East region, but I think also in the world, where the patient can, have this kind of treatment. And you can come have a consultation with me. I will suggest you for the best what is the treatment good for you, and we can plan, your treatment not only for the immediate coming years, but also for the future with the harvesting and cryopreservation of your stem cells.
Great. Thank you so much, doctor.
Thank you so much.